Hello, sorry.
Okay, we're just allowing people to join us. Perfect. So hi, everyone. My name is Alessia Gasco, and I am part of the communications team here at LIDC. Thank you very much for joining today. In this webinar, we will discuss global access to clean water and the impact of the UK government cuts. This session will be moderated by Dr. Oliver Cumming. He is the director of the Environmental Health Group at the London School of Hygiene and Tropical Medicine. Please remind this event will be recorded, and we ask you to submit the questions in the Q&A box. We will allow time at the end of the webinar to respond to your questions. So thank you very much for joining, and Oliver, over to you.
Thank you very much, Alessia, and thank you to LIDC for organising this event, which I think is really quite timely and a really good opportunity for us to think deeply about the importance of water sanitation hygiene, the importance of research for global health and development, and also to maybe reflect a little on the role of the UK government in global health and development. Now, today's session has this sort of headline-grabbing title, which is "Why is the UK government turning the taps off?" As I understand it, this is a reference to a government memo which was leaked a few weeks ago and extensively covered in the UK media, from The Guardian to the BBC, even the Daily Telegraph sort of picked up on this story that the UK government, Foreign, Commonwealth and Development Office, had decided to cut overseas development assistance for water sanitation and hygiene by 80%. So a huge cut, and far greater indeed than the overall cut to UK overseas development assistance of 50%. So I think when this story hit the headlines, it really sort of sent a shockwave, certainly through the water sanitation hygiene sector. And it was really interesting as a researcher, as I am, who sort of, day job is sort of thinking about water sanitation hygiene, to see how this news was responded to in the research community, in the sort of policy and practice community, but also at a political level. And it was notable that actually there was significant criticism of this decision, in fact, from the Conservative Party, from the government itself, and some surprise and shock that something that was sort of assumed to be so important would be the subject of such significant cuts. So today we're going to dive into this question. We've got three excellent speakers who I'll introduce in due course, but they're really bringing different perspectives to this question. We've got people coming from a research perspective, but people coming within that from different methodological or sort of research discipline backgrounds. And we've also got a sort of policy and operational perspective as well. So I'm maybe going to move now to our first speaker, and just really to explain our first speaker and how her presentation fits into the three presentations that we have today. Professor Lyla Mehta is going to start with a presentation under the title of "Why is the UK government turning off the tap during a global pandemic?" So really asking that question, why now? But I think she'll use that as a springboard to really take a much more global look at this decision and the implications. We're going to go from Lyla then to Luke Whaley from the University of Sheffield, who's going to zoom out a little bit and ask the question about the appropriateness, the timeliness of cuts in the time of another critical, perhaps longer term crisis facing many parts of the world in terms of access to sustainable groundwater. And then lastly, we're going to move to Dedo Mate-Kodjo from WaterAid, who's going to zoom out a little bit again, more from an operational and policy perspective, share some of the findings from a new report by her NGO WaterAid, and ask whether retreating from WASH at this point in time represents really a missed opportunity as we get to grips with the challenges of climate change. So that's the package. So I'm going to move now to our first speaker, Professor Lyla Mehta, who is a sort of a very eminent researcher in this field, is a professor at the Institute of Development Studies in Sussex, and also a professor at the Norwegian University of Life Sciences. So Lyla, over to you.
Thank you so much, Ollie. It's great to be here today, and many thanks to LIDC for the invitation. So as Ollie said, I'm going to talk about some of the wider context and also explicitly ask, why during a global pandemic, why this cut? Because, for decades, there's been this budget, this global commitment of 0.7% of the national income that OECD countries have committed to, including the UK. And last year it was announced that this would be cut to 0.5%. And of course, there's been lots and lots in the media, as Ollie has said, and opponents have been calling for these cuts to be reversed. And these opponents even include the right-wing press, many members of the Tory party. And this promise to meet this UN-backed target goes back to the 1970s, and it was enshrined into law in 2015. Now, it's very important to have this commitment simply because of inequality in the world. Global inequality is increasing, and also because of the whole colonial and post-colonial history that Britain is very much part of. Britain was it was one of the most major colonial powers, so it just seems right that this kind of commitment has to be there despite opposition from the public. And I'm going to now briefly outline some of the implications for the WASH sector, the water, sanitation and hygiene sector, and also explicitly draw on research because I'm a researcher. And I want to argue that this is immoral, it's not financial, it's ideological, and it's unnecessary. And basically, these cuts need to be reversed ASAP. So to just give you some of the context, I'm sure most of you know in this audience, we've had decades and decades of international development and also commitment to the human rights, but we still are in a situation in 2021 where we have 2.5 billion people lacking access to safe water, and 4.5 billion, half of humanity actually, doesn't have access to adequate sanitation facilities. And also, even though the human right to water has been globally acknowledged since 2010, it's gross violations of human rights, and no bigger violation goes in the fact that we're talking about poor women and girls spending, 200 million hours a day collecting water. So when you think of what this means in terms of their livelihoods, their life chances, and also the fact that a lot of the water that people have access to is unsafe, it leads to unnecessary deaths, about 1,000 a day of young children. So providing clean drinking water to the world's poorest is one of the most cost-effective ways of improving health and productivity across the global south. And for every $1 invested in sanitation, there's a return of about $5 in lower health costs and more productivity and fewer premature deaths. So apart from the financial costs, there's also huge knock-on effects in terms of human well-being, in terms of life chances, ability to stay in school, productivity, etc. And of course, we're in the middle of a one-in-a-century pandemic. And when we know that we can wash our hands easily, we've been all told to wash our hands, spend 20 seconds doing that, but it's not so straightforward for millions and billions across the world. And having access to those public goods, to health, to water and sanitation are really key to save lives. So in the middle of this pandemic, the UK government has decided to turn the tap off. And this is also 5 years after, most countries, all countries actually, apart from Canada and the US, they still haven't acknowledged it, have acknowledged the human right to water and sanitation. And this is really a pity because, the UK has been a leader in this field. Between 2015 and 2020, the UK helped over 62 million people gain access to safe water and sanitation. And as Ollie said, the leaked memo has highlighted that the cut in the world's poorest countries is by about 80%. So we're talking about bilateral aid for clean water and sanitation cut from about 150 million in 2019 to 30 million. Now, I've been around in the water sector for a while. I've known Ollie for a while, and I remember the meetings that we used to have as a global community or as the UK community on water and sanitation, the kind of collective impetus that there was to really work together. Of course, there were problems. There's always been issues, and you can always talk about the top-down nature of aid and the controversies, but still, to kind of categorically cut it like that is really problematic for a variety of reasons. And even though a lot of the public may, not be very pro-aid and supports these cuts, the leaked memo from the FCO acknowledges public views wash as a priority for UK aid, especially during COVID-19 and also in this year when the UK is hosting the climate conference later this year. And apparently there was said, there's this quote, "We expect criticism on reduction in spend, particularly as UK public views water and sanitation as a priority area because hand hygiene is widely recognized as a critical intervention to counter spread of COVID-19. And ministers have been warned that proposals which calls for 4 billion in cuts would lead to about 70,000 people in the world's largest refugee settlement without health services. 100,000 refugees in Cox's Bazar, Bangladesh would also be without water. So, there are massive implications that we're talking about here. And the government claims that this is just temporary, but temporary makes no difference if suddenly your budgets are slashed, if jobs are lost, and if you're suddenly suffering or dying. So children who are losing their lives, it makes no difference if this is a temporary measure. And as I'm going to argue, it's really unnecessary. So there are huge implications for science and research. And research has had to really be scaled back with the worst impacts often felt by partners in low-income countries. And that we're talking also about many projects that are close to completion that have prematurely ended. And I'll talk in a little while about some that haven't even been able to start. So this does not represent value for money as research already paid for is unable to be concluded. It's also paradoxical because the FCDO has spoken about global Britain positioning itself in terms of science and research, and these are priority areas. But the ODA cuts to the GCRF, the Global Challenge Research Fund, risk long-term damage to the UK's reputation for research and partnership. And we're talking about international programs where cuts up to about 70% have dismantled partnerships that have taken years to establish. And especially we're talking about partnerships where we're really trying to work in a more equitable way, in an interdisciplinary way. It takes a lot of time to set these partnerships up. And these really negatively impact research communities, especially in low-income countries. We're in a global pandemic, and I mean, frankly, look at the mess that the Britain is in right now in terms of the pandemic. And so many countries in Asia have done much better in East Asia than countries like the UK and also other European countries. And so it sort of dismantles this idea of global North and global South. And what we need is mutual solidarity and mutual learning. And this kind of cut is really vicious because it really undermines this idea of global solidarity, of working together to enhance global public goods, to reduce poverty, to improve lives and livelihoods. There's also wider questions because since the DFID's FCDO merger, there's also been a serious lack of consultation with the UK development sector and also with the research community. These cuts were pushed on, there was very little time to prepare. So it's been quite traumatic actually to deal with it. So it's really a marked lack of transparency and accountability. And, the GCRF fund 1.5 billion that it comes to, it was part of the aid budget. So initially I was quite critical that actually UK aid was being used to fund this kind of research, because you could say, the money shouldn't stay in UK research institutions and their partners globally, but it should actually go straight to countries in the global south. But in this short time, I mean, I also believe that it's really supported excellent research to address challenges faced all around in the global south. And it's really encouraged North-South partnerships, it's encouraged interdisciplinarity, and it's challenged new partnerships. So in that sense, it's really been very responsive to the SDG challenges and developed new insights and solutions to the global challenges. And that's why it's been extremely disappointing. And these cuts will also damage the UK's international reputation and soft power. Now, at a time of Brexit, when anyway we're standing alone over here, I don't think that makes sense at all. So it really runs counter to the ambitions articulated in the integrated review to be a science and technology superpower. I mean, actually far from it. So I'm going to give you two examples now. This is a project that I'm part of with colleagues in 4 countries, in Nepal, in Ethiopia, in India, and in Ghana, towards brown gold. And here we're really looking at the sanitation challenge in off-grid peri-urban areas, looking at challenges of marginality and wastewater management. And through intersectional and circular economy approaches, we're looking at how shit can move away from a taboo to being viewed as brown gold. A lot of challenges, but we're looking at the path towards it. But we had a whole year of delay due to the pandemic. And then just when we wanted to get going, these cuts were announced. So it's a cut of about 67% in this current financial year. And so it's and the funding for the future is very insecure. And this has been quite devastating to our partners, because partners have made plans, they've employed people, and suddenly these cuts come. Now, this is another even more extreme example, actually. This is a project that couldn't even take off. Imagine you spend months and weeks and a lot of time, endless emails, doing a proposal, the project gets funded, and suddenly you're told it can't even start. So this is one example. This is the project SMART by colleagues in University of Brighton who are working with us in brown gold, and this focuses on fecal sludge management in the world's largest refugee camp, which houses the Rohingya. And as we know, in terms of conflict, humanitarian situations, WASH is particularly challenging. And despite progress by humanitarian agencies to improve WASH, cholera is a major concern. And also, how do you actually deal with shit on site? How do you deal with it? So it's very important to enhance epidemic preparedness. So this project was seeking to do that. It went through stages of proposals and due diligence, and then suddenly they were informed, quote, because of the level of cuts, it's not possible for this scheme to fund the project because they don't have the funding. So, I mean, can you think of so many projects that were in this situation that were suddenly cut and couldn't really take off? Now, I don't know who this person is. I don't read the Daily Mail, but I Googled this, and this is the rhetoric. So basically it's ideological. There's the Daily Mail, the Daily Express. They've totally been against the aid. They've totally been against this kind of global solidarity. And this is a quote just 2 days ago. There's no shame in cutting foreign aid. It's time for a showdown with the Tory rebels. So there are lots of people in the Conservative Party that are horrified by these cuts. And they were seeking a vote, and hopefully there will be a vote now. And it will come to Parliament, because I think the government will lose. And that's really heartening to know that. But it is actually terrible when you get things like this kind of populism in the press. For example, there are politicians who speak of children dying and as a result of cuts to foreign aid and they're disingenuous. During the pandemic, the public finances have taken a hammering. Yeah, it's true. There's been a lot of suffering here. There's huge inequality. But we also know that during the pandemic, of course, the country's poorer, but, where's the money gone? We've had 37 billion has been spent in tech test and trace, which is actually some shambolic, which has really led to, huge infection rates in this country. Compare that with the way Vietnam and, far poorer countries have managed test and trace. So 37 billion. The cuts come to about 4 billion. And that money they can't find. Instead, they've chucked money at cronies, they've got money in test and trace, and we're also talking about an increase in 16 billion pounds on defense in a global pandemic. So, I mean, this kind of ideological talk, I think we really have to resist it in the global development community and also in the development community in the UK. So I want to just conclude by saying that these cuts, that's my last slide. These cuts are immoral and unnecessary. In the middle of a global pandemic, these ODA and UKRI cuts have brutal impacts, both for the world's poorest as well as UK's global reputation, and also for research institutions, both in this country and also all our partners globally, both in the global north as well as in the global south. And if we look at some of the communications that we've got from partners, they've been absolutely shocked, disgusted, flabbergasted. The UK has emerged as untrustworthy. So just imagine, we've come up with these MOUs and suddenly you can't do anything. You can't do what you were planning to do. These cuts have a devastating impact on global health, on the global challenges, as well as research. They have huge implications for our partners. We'll be hearing more examples from my fellow panelists, and also for early career researchers who suddenly, they were supposed to have a job for 3 years and they probably are lucky if they have it for a year. And so, as I said, the UK also doesn't compare very well with other countries. Before the cuts, it had the second highest contribution, but actually now, and several other countries have exceeded the UN targets. So Denmark, Norway, Sweden. Okay, you can say they're the Scandinavian countries and they're always generous. But, France has committed to increased funding right now, and the US too, and they've increased funding in the pandemic, but the UK really stands alone in cutting. It's very undemocratic. There's been no Commons vote because they would lose. So there really needs to be a Commons vote on this. And as I said, it's ideological. It's not about money. While these cuts of 4 billion have happened, 16 billion have been promised to defense. Why do we need that right now in a pandemic when we actually all need to get back on track? So it really makes the UK stand out. We're anyway a Brexit plague island, and it stands out even more in terms of global solidarity. And, finally, we're not going to be safe on this island until everybody is safe. So we really need that ODA commitment and spending to get this pandemic under control and to get back on track. And so I think that's really, really important. Also this, as Gordon Brown said, we're about to get a huge payment from the IMF. And that covers 6 times over. So it really does not make any economic sense, and it makes no moral sense either. Thank you.
Thank you, Lyla. I think that was just a brilliant first presentation, very much in the now, and asking this question, fundamentally, why has this decision been taken at this sort of point in sort of UK history. And what I particularly liked is how you thought about the risks associated with this decision from different perspectives, both in terms of the sort of longer term commitment and progress on extending access to water, sanitation, hygiene services globally, but also the reputational risk to the UK government at a time when it embarks on a sort of new phase of international diplomacy. And then really that last point about the specific impact on the research community within the UK that focuses on WASH research and how many of the gains, many of the successes and results that have been delivered over decades, often with the support of UK government funding, stand to be squandered. So thank you very much, Lyla. We're going to have a chance to ask questions of our panel. So please put your questions in the Q&A box, and I'll make sure that we return to them at the end. I'm next going to turn to Dr. Luke Whaley, who is a Global Challenges Fellow in the Department of Geography at the University of Sheffield. And his research critically focuses on human-environment relations in the context of development, and he specializes in politics, governance, management of land and water. And Luke's going to sort of move us on now, and he's going to talk about cuts in the time of crisis. And he's going to talk about the cuts in relation to the ongoing rural groundwater supply crisis in sub-Saharan Africa. So Luke, it looks like you've got your slides ready. So I'm going to pass over to you now.
Thanks very much, Oliver. Thanks so much to LIDC for organising this event, and it's great to be here. Thanks to everyone for joining us today. My presentation really follows Leila's in many ways. I'm going to be sort of focusing more specifically on the question of rural groundwater supply in sub-Saharan Africa through the prism of a project I was working on from 2015 to 2019. I think what this project has done is it's part of a sort of broader sort of research agenda, which is highlighting the situation for many people in sub-Saharan Africa in terms of access to water. But it also highlights the importance of water and wash-related research and how untimely these cuts are, not just in the context of this global pandemic, but in the context of other sort of more chronic crises that people are facing in terms of access to basic water and sanitation. So this is a promise from our government not so long ago, 2019, to leave nobody behind. I would say that in the context of these cuts, particularly to water and sanitation, but more broadly, this promise now sort of rings hollow at best, and at worst, I feel like it's a broken promise. At the time, our government was alluding to the importance of sustainable development. It was alluding to the importance of prioritizing the interests of the world's most vulnerable and disadvantaged people, both now, but in the both not only now, but in the future. And we know, so many of us, I think, on this webinar know the situation for many people across sub-Saharan Africa and across the so-called global south. Here in eastern Uganda are some women collecting water from an unprotected water source. The water is highly contaminated. It's also used by cattle, but it's their only water source. There is a borehole in the community with a hand pump, but most of the time it's broken down. And so the sort of knock-on health consequences and other consequences of relying on water sources like this are very severe. Here are some women in Malawi, and of course it's almost always women, collecting water at the same time as having to sort of undergo the sort of drudgery and energy sapping task of collecting water, often walking long distances. Women have to look after their families. They have the sort of the double role of domestic duties and working in income generating activities. And in that context, the time and the labor involved in collecting water greatly reduces their opportunities to do other things with their lives. Now, within this context, there has, in more recent times, in the last decade or so, been a recognition of the sort of strategic importance of groundwater across Africa. This was some work done by Professor Alan MacDonald and his colleagues. Alan is at British Geological Survey in Edinburgh, and thanks very much for this slide, Alan. And this sort of recognition that actually Africa has an abundance of groundwater, perhaps 20 times as much as the sort of surface water stored in rivers and lakes. And that even in parts of Africa where groundwater isn't that prevalent, there is still enough to supply a hand pump, 5 times as much as is needed to supply a hand pump. And so in the context of climate change, in the context of a growing population, the sort of strategic importance of groundwater is now recognized and is being focused on. But this question of hand pumps is something which isn't new. Since the 1980s, the UN Water Decade, there's been a strong drive across rural sub-Saharan Africa to provide communities with a borehole equipped with a hand pump. And this sort of drive has been reinvigorated in the early 2000s with the Millennium Development Goals. And so there's been a strong drive to supply water infrastructure to communities across rural Africa. But that's often been at the expense of the sort of sustainability of this infrastructure, the sustainability of hand pumps. And it's estimated that at any one point in time, between 15 and 50% of water points aren't working. And this situation is being dubbed a hidden crisis. A crisis, obviously, because it's so prevalent, so many water points are non-functional, and hidden because it tends to fly under the radar of official statistics. So now there's a strong focus on the functionality of these water points, of these hand pumps, and of the communities that have been charged with managing them. The dominant sort of policy model for managing rural water supply is called community-based management, and it's often operationalized through a voluntary community committee in the community who are charged with looking after the water point. And so within this context, I was involved on a project, as I say, it ran from 2015 to 2019. It follows in the name of the crisis itself. It was called Hidden Crisis. It was part of a broader consortium called UpGrow, Unlocking the Potential of Groundwater for the Poor. And we as a project team were looking at this situation of the functionality of rural water points and of the management arrangements within communities for looking after those water points across Ethiopia, Uganda, and Malawi. And we were a large interdisciplinary team made up of institutions from Ethiopia, Uganda, and Malawi, research institutions, as well as in Europe and in Australia, from both the social sciences and the physical sciences. And we're also working closely with WaterAid, and it's really great to be here with Dedo today for WaterAid. And we're also working with the ODI. So a sort of large interdisciplinary team, partly funded by what was then DFID, the Department for International Development, and partly funded by UK aid. And as Lyla has sort of made the point Lyla has made very well, is that this sort of research fundamentally has relied on funding from UK aid, and the GCRF fund is more recent. And without it, these sorts of collaborations, these sorts of partnerships, this sort of interdisciplinary working, which is so crucial to tackling these very complex global challenges around water and sanitation, just can't happen. So here's the project, the Hidden Crisis Project team in a meeting in Kampala in 2018. But in the context of these cuts, and as Lyla has said, many projects now just having this sort of the carpet removed from underneath them. Some projects were cancelled before they started, others were cancelled some of the way through. And not only the research capacity is lost, but a huge amount of trust has been lost. The relationships have been severed. And there've also been people, PhD students, master's students, who have been working on these projects, who have been depending on these projects for their careers and for career opportunities. And those opportunities have also been lost. So it's been a really sort of callous and about turn by our government in terms of this funding. I don't want to go too much into the details of the project sort of methodology and stuff, but just to say that we worked across Ethiopia and Malawi and Uganda, both extensively doing a survey of water points, of hand pumps, to understand their functionality and why they are, whether they are working. And then also we took a much more detailed approach, going into communities, understanding the dynamics in the communities for managing these water points, taking apart the water points to understand why the issues we've noted in our survey were happening. We also worked with community members over a whole year in Malawi and Uganda, who kept a diary of their relationship of accessing and managing water and embedded this within their wider lives and livelihoods. And one of our first tasks was to define the functionality of water points, which seems fairly obvious. Surely a functioning water point is one that is producing water, and a non-functioning water point is one that isn't. And that's historically been the approach that's been taken to understanding functionality. But we took a much more nuanced approach, which was not just interested in whether the water point was producing water, but was there water of a sufficient quantity, and was the water point reliable? That is, had it broken down for less than 1 month in the previous year? And once you have this more nuanced approach to understanding functionality, you realize that there's a whole range of outcomes which paint a very different picture of the service people are receiving in terms of rural water supply, all the way from the top right, fully functioning, where the water point produces water of a sufficient quantity and it's reliable, to whether the water point is partially functioning, either because it produces enough water but it's not reliable, or it doesn't produce enough water but it is reliable, or it doesn't produce enough water and it's not reliable, all the way down to whether on the day that the team visited the water point it wasn't working but it worked in the last year, or finally at the bottom right, the water point had been fully abandoned. And the reason why this sort of nuanced approach to understanding functionality is important is, as I said, it paints a very different picture of people's experiences of accessing water on the ground. As I've said already, it was noted that up to half of water points don't work. But let's take Ethiopia as an example. So in our survey, 82% of the water points we visited were producing water, a sort of basic question, yes or no. That's very similar to the sorts of national statistics you see of governments across sub-Saharan Africa. But then if we also ask, was it producing enough water? Well, only 59% of water points were producing water with enough quantity. And then if we ask the question, well, was the water point also reliable? What we find is that only 45% of water points were producing water that was enough water and that was reliable. So a very different picture in terms of the access to water that people are receiving. And finally, if we then also include whether the water quality was sufficient, what we find instead is that a very small, a much smaller number of water points are fully functional, because alongside these issues of quantity and reliability, there's the issue of water quality. And I've got something in front of my screen, but I think that the number there is around 22% of water points were fully functional when you take into account the quality of the water they also provide. So why are so many water points failing? And this is where the sort of interdisciplinary and collaborative approach to research is so important. So working in the same communities, the same sites, the social scientists and the physical scientists went into great detail to understand this question. The physical scientists deconstructed the pump, they tested the aquifer, they looked at the chemistry of the groundwater, they looked at the borehole construction, and then the social scientists, of which I was a part of that team, alongside my colleagues, Francis Cleaver at Lancaster and Evans Mutunga at Chancellor College in Malawi. We used a range of social science methods, ethnographic methods, participatory methods to understand community dynamics and management arrangement dynamics in the community. Now, I'm not going to speak about the sort of findings of the project because that's not really the point here, other than to say that the findings were very complicated. They involved the interacting variables of groundwater, of borehole siting and drilling, of pumps and parts, of the community dynamics, and of how all these things interface. So a very sort of complex picture underlying this question of water point functionality. But what I will focus on in the last few minutes of this presentation are just some of the challenges the community faced. And these were sort of common challenges. One was a lack of district support. So communities, often when the water point broke down, if there was a substantial problem, they weren't able to fix it, but there wasn't the district there to provide support either. So they were sort of stranded and abandoned in that sense. Communities routinely faced high water stress through dry periods and heavy demand on particular water points because of high population pressures. And they also faced cascading pressures because often water points were broken down. So for example, if a neighboring village's water point was broken down, that whole community would come to the water point in question and also use it, causing that water point to break down more quickly and causing tensions and conflicts. But this question of water point functionality and water supply also there's ramifications through broader society. I haven't got time to go into them, only to touch on some of the ways in which this works in terms of, say, functionality and gender. Well, we saw in our diaries, for example, how women who had to wait a long time in queues because the borehole was in heavy demand or because the water point wasn't functioning well, they were often reprimanded by their husbands, both verbally and physically. We had horrible accounts as well of women being beaten for being away from the household too long, simply to collect water. So for example, this one diary keeper's quote, "Also due to delays at the borehole, some women are suspected to be with other men. It's frequent here that women are bitten by their husband because of water." Whilst another woman said, "I fetched water for all domestic activities and my hens, but because of too much of a queue at the borehole, the opposite sex becomes mad and weird. Please give us another borehole." And then finally, I just want to highlight how rural water supply is not just about basic needs and a minimum amount of water required for people to survive. It's also about thriving and about living an enriched and meaningful life. And we found in our research how water is bound up in so many cultural and social practices in communities, from mosques and church services, weddings and funerals, celebrations like Ramadan and Eid, to cultural ceremonies and rituals like in Malawi, Gulawam Kulu, which is a sort of masked dance. And here the borehole was always in much higher demand because people relied on it fundamentally as part of the sort of the gathering together of these cultural ceremonies and practices. So just in concluding then, I'd like to say, that this research project paints a part of a broader picture, which is that water is a cornerstone of people's lives and livelihoods, not just, of course, in sub-Saharan Africa, but across the globe. And it's not just about water for meeting basic needs, but water is also a fundamental aspect of people's wider social and cultural worlds. And I think that's really important, and it's often left out of a lot of development discourse. The challenge of achieving water security is complex, for example, for the reasons I showed in the project, the Hidden Crisis project, where even the question of a functioning water point seems to become very complex. But with interdisciplinary and collaborative approaches, I think that these water challenges and the challenge of water security can be better addressed and better understood. But this situation, finally, in sub-Saharan Africa underlines the importance of funding for improving water security, both through research and through development practice. And obviously, whilst I've spoken about this hidden crisis of sort of sustainability of rural groundwater supply, no more has there been an inopportune time for funding cuts than right now during the global pandemic and in the context of growing populations across sub-Saharan Africa and the global north, and in the context of climate change. So within that context, these cuts seem very unwise, very ideological, and very badly timed. And I'll leave it there. Thank you.
Thank you, Luke. That was a fantastic presentation, and I think it was very helpful because obviously overseas development assistance isn't just about sort of bilateral transfers to government or funding projects and programs. We've talked also about the importance of research, and I think sometimes, particularly at a political level, research is never seen as a priority, certainly in comparison to sort of getting services to people on the ground. And I think your case study with the UpGrow project really illustrated the value of research and the dividends of UK government investment in really understanding these issues and bringing an interdisciplinary approach. So thank you, Luke. I'm now going to turn to our last speaker, who I'm really pleased to welcome today, because she is not a researcher. She is Dedo Mate-Kodjo, and she's got a very impressive title, so I'm going to have to just check my notes. But Dedo is the Pan-Africa Program Manager at WaterAid. So, covering a number of countries, different settings. I imagine quite a complicated job. And you're going to talk, I'm pleased to say, not just about the risks associated with this decision by the UK government and what that means in terms of sort of WASH services and the challenge of extending access. But I think you're also going to take a sort of positive perspective on WASH as one of the ways in which we can respond to climate change and embrace green economies. So just before I let you start, Dedo, I'm just going to remind all of our panel that we've got a Q&A box, and there are already 5 big questions in there. So at least for Luke and Leila, you can start priming yourself on those questions, and so that you're ready to respond. But I'm going to hand over now to Dedo to present, please.
Thank you very much, Oliver. And let me also reiterate how pleased I am to be here. Thank you very much, LIDC, for organizing this webinar. It couldn't be more timely because, seriously speaking, it's kind of a time when lots of research is happening, and the Joint Monitoring Report research was out last week that says that achieving universal coverage by 2030 will require a quadrupling of current rates of progress in safely managed drinking water services, safely managed sanitation services, and basic hygiene services. But just to pick up from where both Dr. Luke and Leila left off, there's never really a good time to cut aid for life-saving water and sanitation. But seriously speaking, right in the middle of a pandemic, is one of the worst. And what is more incredible is that these cuts to the funding of water and sanitation, which is the first line of defense against the twin threats of COVID-19 and the impacts of climate change, has come to a time when, the UK government is leading, is hoping to demonstrate its global leadership in G7 and COP26. The cuts, as Leila has mentioned, are particularly disappointing, given that we are currently in the middle of a global pandemic, and one which both the World WHO and national governments have emphasized hand washing as one of the most important modes of defense. And it puts all the other gains around water and sanitation and hygiene on these sustainable development goals at a risk. If 80% of bilateral program is cut, then a staggering 10 million people stand to lose out on gaining access to clean water, sanitation, and hygiene facilities this year alone. And I think some of the images that Luke showed us is a fact to that. WaterAid's ambition is to reach everyone everywhere with clean water, decent toilets, good hygiene by 2030. And since our founding, almost 40 years ago, the 21st of July will be our 40th birthday, we have worked alongside international agencies, national governments, including the UK government, to bring clean, safe water to over 20 million people, sanitation to over 18 million people living in marginalized and underserved communities globally. The United Nations Sustainable Development Goals aims to end poverty by 2030 by uniting countries around the world to tackle the underlying inequalities that we see throughout all the development sector. The SDG 6 and its intricate linkages that it has with the other SDGs, for example, health, gender, climate change, life on land, partnerships, and the overall well-being for populations has been a major focus of WaterAid's work. As Dr. Lyla mentioned, 5 years into the implementation of the SDGs, the world is experiencing a global pandemic, which is ravaging nations, decimating economies, reversing both well-being and economic growth end indicators across the globe. 5 years into the SDGs, the whole world is collectively not on track to achieve SDG targets 6.1 and 6.2. However, the challenge to reach the SDG targets are mostly felt in a lot of our developing countries or least developed countries and countries with fragile contexts. Many rural communities, underserved and vulnerable populations stand the risk of being left behind, and many of these are in Africa. I think Luke's illustration also highlighted that. The reality of the situation is that many countries in the global south are water resource stressed or constrained. Despite best efforts, there is a lack of adequate investments, infrastructure, prioritization to some degree, and the impact of climate change, severe droughts, hurricanes, flooding, which disrupts economic activity, destroys infrastructure, pollutes freshwater systems, and leaves human destitution in its wake. Building back the economy and infrastructure will be a challenge across board, and especially in developing countries. The provision of water, sanitation, and hygiene has huge impacts on the lives of girls and women. And I love the images that you showed, Luke, affecting the ability or our ability to get an education, give birth safely, or in our role as health workers. It'll damage maternal and child health indicators, and it'll be harder for more girls to get a good education. And of course, underlying all that is the hindering the fight against antimicrobial resistance and weakening responses for COVID-19 and our preparedness for future pandemics. The UK government's decision, therefore, to reduce spending on WASH has come at a point in history where, we stand the chance of eradicating or reducing any of the SDG targets that globally we've been trying to achieve. And I think from both Oliver and Leila's presentations, we see that also reflecting in research for innovation and research for advancement of our interventions. The pandemic has shown that it is important to have a concerted global effort to ensure global health security, to avert the spread of infectious diseases, and that no country is an island on its own. In our recently published report, Mission Critical, Invest in Water, Sanitation, and Hygiene for a Healthy and Green Economy, WaterAid makes the economic case for water, sanitation, and hygiene, and shows how investments can have a long-lasting economic, environmental, and health benefits, enabling communities to respond, recover, and adapt to new threats. The report also demonstrates that investing in WASH is a cost-effective way to reduce endemic diseases, improve economic opportunities, and build resilience to future health and climate risks. In the report, we are saying that by investing in WASH, health outcomes would also be improved through the reduction of cases of diarrheal diseases, worm-like parasites, dehydration, etc., etc., etc. And that hand hygiene, as has been made evident by our responses to the pandemic, is a cornerstone public health recommendation against infectious diseases and disease outbreaks. And that universal access can reduce cumulative infections by up to 20% of COVID-like respiratory infections just by, if there are no other interventions, hand washing can reduce it by 20%. By investing in water, sanitation, and hygiene, environmental outcomes would also be improved by reducing the pollution and contamination of land and water resources. Investment in water and sanitation infrastructure meets the criteria for a strong green economic stimulus investment. This can be timely, targeted, and transformational, enabling a durable recovery from COVID-19 and the economic recession that we find ourselves in. By investing in WASH, social and economic outcomes will be improved. The provision of basic water services saves women and girls the equivalent of 77 million working days per year that we currently spend fetching water, and thus improving our productivity and opening up opportunities for economic advancement. Excuse me. Investment in WASH in healthcare
I think, unfortunately, I think Dedo has maybe lost her connection. Welcome back.
Oh, did you lose me?
We lost you for maybe half a minute.
Okay, sorry.
You could rewind a little bit.
I'll just continue. Our report also confirms the multiple benefits of achieving universal access to safe WASH services, such as unlocking trillions of dollars of value over the next 2 decades. So for example, achieving universal access to safely managed sanitation is estimated to yield net benefits of $86 billion per year between 2021 and 2040, so going beyond 2030. While universal access to safely managed water supplies could yield net benefits of $37 billion per year. Now, when we talk about safe water, managing water supplies, we're looking at both groundwater, surface water as well, that Luke has made allusion to. And then protecting water and sanitation infrastructure from flooding, and not just from flooding, but from climate change effects. It's also shown to be highly effective. Every dollar spent on ensuring water infrastructure is resilient to flooding could avoid at least $62 restoration costs. Restoration costs that prevent life-threatening contamination of drinking water sources, and that demonstrates how crucial water investments are for building climate resilience. Therefore, global leaders must ensure that the economic recovery from the pandemic includes investing in water, sanitation, and hygiene, and that achieving universal access as set out in the Sustainable Development Goals should take center stage in this journey. On the UK cuts, WaterAid has condemned these cuts publicly and in very strong terms. Our political strategy has been to make cutting WASH politically painful to the UK government through political lobbying, organizing, and our media work. Secondly, that we're working towards the restoration of the aid budget to 0.7 GNI next year, and to have WASH as a priority in that restored budget. It is probably too late to reverse the cuts now, but they are already biting on the program pipeline, as already evidenced by both Professor Lyla and Dr. Luke. But we can limit the damage by placing WASH at the center of discussions on COVID recovery and future pandemic preparedness. And so as globally, we're preparing for COP26 and G7, our call to action is that governments, international organizations, donors, and businesses should lead the way in providing substantially increased and sustained investments in water, sanitation, hygiene infrastructure and services in low-income countries and middle-income countries this year and onwards. That these investments are essential for the public health response to COVID-19, for economic recovery, and a core element of future pandemic preparedness. The mobilization of resources should be central to financing the annual 229 billion capital requirement for LICs, and to restore progress for us to be on track for the SDG 6 by 2030. And that we're also asking for multilateral and bilateral donors and private sector investors to strengthen their collaboration to create the enabling environment to increase preferential water investments to the poorest, most vulnerable communities in climate change hotspots. But at home, looking at what WaterAid is doing, we've been working with national governments on advocacy for WASH investments in healthcare facilities, in schools, and in communities and countries where we work. We're also engaging with regional bodies like the Southern Africa Development Commission, the East Africa Commission, to address hygiene investments. And we're working closely with the African Ministers' Council on Water and the African Development Bank to support sanitation policy and rural WASH investments on the African continent. I'd like to end my presentation by making a quick reference to the words of the Prime Minister Boris Johnson at the UK Africa Summit of January 2021, as reported in the Africa Report online paper. And I quote, "One thing that absolutely has not changed is my ambition for the UK to be Africa's investment partner of choice." Now, I've raised this because of the, for me, question marks. You cannot say one thing and do another thing. So in my opinion, the UK needs to start leading the way to mobilize funding to resource what is needed for addressing climate change and WASH investments. Thank you very much.
Thank you.
Back to you, Oliver.
Thank you very much, Dedo. That was fantastic. I have to say, I was not expecting Boris Johnson to be quoted at the end, but I thought it was very, very appropriate, and I think ties into this theme that's come through all three presentations around promises and broken promises. I was particularly struck, Dedo, by your, you shared with us the WaterAid mission, and hopefully most people will know of WaterAid, but I think it's fair to say it's the sort of largest international NGO in the WASH sector, so speaks with some authority. But you said the mission of the organization is safe water, sanitation and hygiene for all by 2030, which, listening to you say that, makes me think that's not terribly ambitious for humanity today. And I think reflecting on the joint monitoring report on Sustainable Development Goal 6, which was published on Friday, where the United Nations effectively put up their hands and said, we are not on track to meet SDG 6, which is similar to WaterAid, universal access to safely managed services. I'm going to, just before I go to the questions, I'd like us to remember one thing which Dedo said in terms of the WaterAid strategy, which I thought was very interesting, which was about making it politically painful. And I personally, I found this quite a powerful statement, and quite interesting to think about how, when bad decisions are made by the UK government or indeed any other decision makers, and they are inherently political, possibly ideological, how do we make those decisions more painful? So maybe we can keep that in mind as we go to the questions, and maybe at the end come back and conclude around how we might see, to steal the objectives of WaterAid, the restoration of the 0.7 commitment, and to really see WASH as a central part of making that case for the restoration of the 0.7 commitment. So panel, that was your 2 minutes to get yourself prepared for some difficult questions. I'm going to go now, and I'm going to sort of pick them off and try and do so in a logical order. But the first one is a question which I have to say I have encountered from officials within FCDO, within the UK government. And the question is, in your experience, in light of these budget cuts, what do you think are the most effective WASH methods to utilise to improve health and sanitation in communities on a low budget? So if we accept these cuts, what are the priorities in terms of low income settings? So yeah, I'm going to go in the order that you spoke, and maybe invite Lyla. Would you like to respond?
I mean, it is a tricky question, but I guess, I mean, one thing is these are already very low budgets. Sorry, I'm just trying to, the budgets are low as it is. As Luke has highlighted, there's lots of complexities around what's happening on the ground. So there is no quick fix, I think. You can't prioritize one or the other. I think they're all interconnected, which of course policymakers don't want to hear. They don't want to hear about the interconnectedness. They don't want to hear about the complexities, about bringing together the social and the physical. I mean, I would say that all these municipalities and district authorities are anyway working on a very cash-strapped budget, and they're very, very innovative. They're doing their best. So why cut even further? That's what I would say. And, you know, we're not talking about a lot of money to meet the SDG target. It's, what is it, 10, 20 billion, basically, to provide the most basic. I mean, if rich countries can't do that now in a pandemic, I don't know when they'll do it. So frankly, you know, yeah, that's my answer.
Yeah, I like that. I think I don't think the person asking the question that this was her or his intention, but there's sometimes a trap in this question that you accept this framing of the discussion about, we don't have enough money, so what's the most cost-effective option? Whereas actually the issue is about prioritizing these very basic, and as you said, Lyla, cost-effective or just plain sensible intervention. So I'll maybe pass to Luke, and then Luke, we maybe give a chance to Dedo as well to come in on this.
Yeah, so I would echo what Lyla said, and sort of that remit of what's most cost effective, I think, is a very narrow and sort of pernicious way of framing this debate. I won't so much speak about methods, but I think what I will highlight in the context of these cuts are policies and thinking about what works and what doesn't work. And so just within the context of, say, rural water supply, there's often a large gap between the sorts of policy aspirations and how things should work and how things actually work on the ground. So I would say a first step potentially is to get more real with recognizing those realities and to sort of revise policies accordingly. So I'm thinking in particular now of something I've spent a lot of time on, which is community-based management, where a community, resources are put into the community forming a committee, 8 to 10 people, a treasurer, a chairperson, etc., who must look after the water point. Now, in my research, that almost never happens, but a lot of resources are sort of put into this dynamic. To my mind, I think there should be a much stronger focus on local district capacity, on government capacity, and that's a question for central governments as well as for sort of donors, rather than spending money on sort of processes and policies which in theory look good, but in practice don't work that way. So I think that donors and central governments need to get real about how things work on the ground. And to that extent, there's sort of more research these days going on with something called working with the grain, which is working with existing social relations, leaders and sort of institutions in communities to get things like water sort of operation and maintenance done through existing channels. And that comes with its own dangers, reproducing power inequalities in those communities, etc. But also it's a more realistic way of working. So in the context of these cuts and in the context of development funding more generally, that would be my sort of orientation with that question.
Thank you, Luke. And I jotted down "get real with reality," which I think is a
I think that's tautological. So
right, Dedo, over to you. But just to let the panel know, we've got a lot of good questions here. So let's move quickly and keep going. Yeah.
Okay. Well, actually, just to add to what Luke mentioned, some of the experiences that WaterAid has had is we forming local advocacy groups that work with the local government. And so, they are close to the ground and they ask the local government to meet their needs. I'm talking about a situation where, the local group has asked for interventions at their healthcare, at the healthcare center. They've done the agitation. I'm talking about an experience where, we've worked with community members to manage surface water, right? So that they can tell, they train them to collect data, in association with the local government, to collect data, to know the levels, to know outputs, and then, to be able to determine how to use both the water points and then, the river water source. And then lastly, to look at sanitation side as well. Again, training local artisans. We've invested in training local artisans, including women, to build their own local toilets cost effectively using local materials. Of course, not in every instance has it worked and sustainable, but the overall impact has been that self-service, to use that word, has been one way to look at it. But at the same time, continuing the advocacy at local government level for those services to be provided. So that's one way of looking at it. Thank you.
Excellent, thanks, Dedo. I'm going to go now. I'm going to read out a comment, and then I'm going to couple it with a question. So the comment comes from Hugh Waddington, who's an economist, a researcher at the London School, in fact, London School of Hygiene and Tropical Medicine. And Hugh's reflection is, I'm interested in the panel's views about why aid to water and sanitation seems to be considered less important than other areas by the UK government. Surely even the Prime Minister cares about the bad press associated with children dying and the cost to UK government priorities like women's empowerment. Now, there's a sort of kind of, sort of reflection from Hugh. I would like to go from that to a question, a separate question which has been posed, which I think is an interesting one. And the question is, how is the decision made on how the aid budget is spent, whether that's 5 billion or 7 billion? And is there really a moral way to decide which projects get cut? So if you could maybe sort of think about sort of Hugh's response, and then maybe think about this, I suppose, more abstract philosophical question about how those decisions are made about priorities. So I'll maybe ask you to react to that, but if you could briefly, and then we'll have time for a last question, hopefully. I'm going to go the other way around this time. I'm going to start with Dedo, please.
Again, from practical experience of WaterAid, you know, we believe in working very, very closely with government. So some of the things that we have done in the past is to do the research, you know, and use this research to meet with the Ministry of Water and Sanitation, Ministry of Health, and then start the lobbying and advocacy there. So for example, you know, we did some work around washing healthcare facilities, you know, the lack of washing healthcare facilities in some of the facilities up north. We presented that in a colloquial form with the ministry, and based also on the WHO resolution that was passed in 2019 around washing healthcare facilities, we're using that as our lobbying and advocacy with the ministry, with the hope that, you know, something may change. I must say though that I think it was 2 years ago, there was a slight increase in the wash budget from the Ghana government, based on not just WaterAid, but the whole coalition of wash stakeholders making that bid. Yeah.
Great, thanks, Dedo. It's actually a really important reminder that the UK commitment may be going in this direction, but there are sort of many other governments where the commitment is going in the other direction. I think you said, it was the Ghanaian, government as an example. Okay, Luke, just quickly, please, on this one.
Yeah, very quickly. So I think the question, why are the government doing this, given sort of the obvious consequences and the optics of it? I think they don't particularly care about those people. They're indifferent at best to them. So the only way that will change is if they get hurt in the ballot box. But until that point, I don't think they care. Is there a moral way of deciding, amongst projects given these cuts? No, not easily, I don't think. I think because we're talking about such fundamental sort of services, I don't think there's an easy way to decide. It really is very callous.
Yeah, very, very clear. Leila?
Yeah, I agree. I mean, there have been cuts. They don't care. It's been in the press. There's been lots of lobbying. Researchers have done it. Lots of people have done it. They don't care. And there have been cuts to all sorts of other things, not just water and sanitation, women and girls empowerment, education. I mean, countries like Yemen, the Horn of Africa, in the middle of crisis, conflict, all got cuts. And I just think the decision-making has largely been arbitrary. People just don't know what's been cut and where. And that's why they've just sprung surprises on programs, on projects. So it's actually very chaotic too. Even if you're cutting, do it responsibly. And that they haven't done that at all. It's been very arbitrary.
Yeah. Brilliant. Thanks, Leila. I think, it's really, sort of Luke's response, they don't care, sort of takes me back to sort of Dedo's sort of summary about making it politically painful. So my very last point, I'm going to ask the panel to respond in just 10 or 15 seconds, is a question which I think speaks to possibly a risk of complacency that we, at least in the UK, had maybe taken the case for overseas development assistance for granted, and had maybe stopped making the right arguments, stopped making it politically painful for politicians to retreat. So the question is, do you think there's a way of ensuring that a similar cut won't happen in the future? As a bare minimum, there should be a guarantee that projects which are already planned will receive the promised funding. If not, what do you think? Do you think the risk of suddenly losing funding will likely make people more wary to take on these projects? And I would add to that, less likely to sort of engage in the water, sanitation, hygiene sector. Yeah. Okay, so I'm going to, I think Leila, if you could go first. Okay,
well, I mean, I think the way to I think one thing we could do better is to make a case for aid to the wider public in the global north. There's a lot of negative attitude towards it. So, why is it still important? Why is it important to stick to that commitment? Because I think this government is a populist right-wing government, and they're playing to their base and the media. So, how do we flip those arguments? And also, I think, it's obviously we'll all continue to commit to these projects because they're important. And obviously these cuts shouldn't happen halfway, but does global Britain want to do this? Is that what Britain wants to be seen as an untrustworthy, callous international partner that is not interested in global solidarity? So I think that's really a question for this government, and basically also for voters. Do you want to vote for such people?
Thank you, Lyla. Luke?
Yeah, just very quickly to say, yes, this has undermined trust, and I think it feeds into a much broader process of sort of precarity, not just in terms of funding, but in terms of the way our economy is structured. But what I would briefly say is that there does seem to be cross-party sort of outrage at this, perhaps even more on the right than the left. So outrage for different reasons, but that is a point at which I think people can mobilize, people can campaign. And as Lyla said, there's a need to therefore influence public opinion based on that. Sort of mobilization across parties. So I'd say there's the ray of hope there.
You're lucky you have the last word, but if you could make it concise.
Okay, I'm going to take it from the other side, right? Because I'm in the field. And one of the strategies that WaterAid uses is having those critical conversations at country level with the donor counterparts. So for example, we would go into the FCDO office now, in any of our countries that we're operating in, inviting them not just to our interventions, but interventions of the coalitions that we're working with, right? Make them understand the importance of UK aid in the wash sector. Of course, and so we understand that UK aid strategies are all country-led. And so I think if there's a groundswell of critical arguments from the field that may or that should change, should change whatever happens from Parliament in the UK. But that is one of the strategies we use, making sure that we are lobbying effectively at country level, all those agencies as they're developing their local strategies for the countries that we're working in. Yeah. It is a difficult one, but that's one way of looking at it. Thank you.
Yeah, thank you. I think it's a really good point to conclude on, Dedo. Thank you very much. I'm sorry, we've run over by 3 or 4 minutes, so I'm just going to sort of very quickly close. I think for me, sort of listening to our speakers today and seeing the questions, I'm struck by the energy around this. And what's very clear is that there's never a good time to retreat on commitments, promises around aid and certainly investment in WASH. But now is really the very worst of times to be doing that. And I think what's interesting is that it has made, if you like, strange bedfellows of quite diverse perspectives and interests. And I think that's an opportunity. So I think whether it's in terms of bringing together people at the policy or operational level, activists at different levels, scientists and researchers, but also across the political spectrum within the UK to really respond to this threat. And I think, the sentiment of surprise, shock, indignation has really run through all of the interventions today. So I hope this is an opportunity for the sector to, if you like, re-energize and come together and really just to push back as strongly as we can with some of the powerful arguments that we've heard today. So thank you very much to our speakers. Thank you, Dedo. Thank you, Luke. Thank you, Lyla. And thank you in particular to LIDC for organizing this event. And thank you to all our participants for joining and for the questions. Goodbye.
Thank you very much, everyone. Bye-bye.
Thank you very much.